Welcome to UroNurse News. I'm Vic Senese, and in this episode, I examine the growing role of nurse practitioners and physician associates in American healthcare and what it means for patients and the profession. For much of the 20th century, physicians ruled American medicine, but it wasn't always that way. As author Paul Starr documented, doctors rose from what we called a weak traditional profession to dominate healthcare delivery by century's end. By the late 1900s, worried about a surplus, physicians even lobbied to limit the number of medical schools and residency slots. But as the U.S. population grew, the number of physicians per capita stagnated. Today, the U.S. has just 2.6 physicians per thousand people, well below the developed world average of 3.6 per thousand. And with an aging, sicker population, we're short about 125,000 doctors, a gap expected to reach 200,000 by 2037. So, who's filling this gap? Two newer professions, nurse practitioners and the physician's associates. In 1965, the University of Colorado launched the first nurse practitioner program, and Duke University started the first physician assistant program. At first, their numbers grew slowly, but since 2000, they've exploded. Today, America has 280,000 nurse practitioners and 145,000 physician associates, making up a full one-third of the clinical workforce. They now deliver over a quarter of all healthcare visits, more than in any other country, and their numbers continue to grow. But are nurse practitioners and PAs care equivalent to physician care? After college, physicians complete 7 to 11 years of medical school and residency, with about 12,000 to 16,000 patient care hours. By contrast, nurse practitioners who start as registered nurses add 1 to 3 years of training with around 500 to 1,000 patient care hours. PAs complete 2 to 3 years of training with about 2,000 hours of clinical expertise. Despite the stark difference in training, research shows that in most settings, physicians, NPs, and PAs deliver similar quality care, though some exceptions remain. Still, critics point out that there are no randomized controlled trials proving the safety of unsupervised NP care for typical patients. And even after decades in medicine, many clinicians say good and bad providers exist across all professions. So, what questions should we ask now? First, how can all clinicians best meet the population's needs? NPs and PAs and physicians have overlapping scopes of practice, but also unique strength. As one PA leader put it, we're not trying to be physicians, we're here to do what we're trained to do, care for our patients and communities. Second, how do we ensure everyone is well prepared, especially as some NP programs, especially online and for-profit schools, have come under scrutiny? And third, how should care teams be configured? Some problems are well suited for protocol-driven care, like urinary tract infections or high cholesterol. Others, like complex depression or Crohn's disease, may demand deeper expertise and broader experience. But with an aging, sicker America, we'll need all hands on deck. As one health economist put it, when physicians and non-physicians perform the same job, are the physicians overtrained or the physician's assistants undertrained? The answer isn't always clear, but all professions must keep examining how much training is truly necessary, how much experience is enough, and how artificial intelligence may soon change everything. So the next time you hear the NP or PA will see you now, know that behind this phrase is a profound shift in healthcare and a team effort of care for you. Thank you for joining us on this UroNews special report. I'm Vic Senese. Stay informed and take care. Hey, on this week's episode of UroNurse, Dr. McHale shares his clinical insights and real-world experiencing using multiphase in both clinical and post-operative settings. Never heard of multiphase? Tune in. Hear directly from the expert about how multiphase enhances infection prevention, why it's so easy to use even in busy practices, its measurable impact on workflow efficiencies and patient outcomes. Whether you're a healthcare provider, nurse, or practice manager, discover how this innovative solution can improve care and streamline your day. Watch the full interview on UroNurse.com tomorrow at 9 a.m. Central Time and learn how you can bring the benefits of multi-phase to your patients.